We've got quite a few questions, and Alice is going to help us with the questions. So over to you, Victor.
Good evening, all, and thanks for inviting me to chair this segment of the program. We've got some questions which Alice has been popping over to me, but we want as many comments or questions from people as possible so that we can better understand the issues. I don't want the questions to be limited to members on the panel, which is Dr. Sarah Belfield and Mrs. April Pabadi, but I would want to bring some of the questions might be directed to the presenters as well, because there are follow-up questions from, that were popped in from your presentation. And if you have, as we go along, if you have follow-up questions, please do put them in the chat. There are too many people in the forum for us to be able to pick, whoever's put their hand up or something. But if you were to put it in the chat, then it will be easier for us to pick up the comments or the question and to share with the group and to get somebody to answer. The first question I have to ask, I know you've put an answer in the forum, in the chat button, but it would be nice if you were to explain this further, which is to Deepak. The question is, do you have any experience with cancer patients getting services during the lockdown? Particularly the first phase where everything was protracted.
I think it was Nisha who asked that question, and I think the work that she's done is really a good example of how we've changed and adapted so quickly the next time around. So in the first wave, we didn't know anything about this virus, and it was all very much centrally led as to this is what we've done. So we generally stopped doing everything that was considered effective, and a lot of cancer services got stopped nationally, locally, because we just didn't know what we were dealing with. And we learned very soon. By the second month itself, I remember speaking to my cancer colleagues, my oncologists, and they realized that this was not the right way for lots of patients who were starting to miss their chemotherapy regimes or the other treatments there are. So what we have to accept is that we did have to learn that the first wave and the way we looked after cancer patients or screening and all that could have been a lot better, and there were some delays that occurred. But I think as far as I'm aware, my hospital has been remarkably good this time around in terms that we have made sure that we've separated the COVID hot and cold spaces. We've ensured that cancer services, surgeries, important trauma-related surgery and anesthesia does not get impacted. There's all the treatments and the follow-ups and everything has been either virtual or face-to-face. It's been made possible, and I think we will not have those issues the second time around in this wave or any other waves that may come along. However, I have to accept that some of the community services on which cancer services, and for that matter, even pain, we are dependent on acupuncture, on aromatherapy, on hypnotherapy, on psychology, on mental health counseling, that all has been impacted, and some of them have not been under our control, which is why I was very happy when Nisha actually said that she's been working with, I think she actually commented here that she's been working with the Macmillan and the comms department at RBH to actually provide more targeted and, as I said, culturally sensitive ways of getting the population. So I think, I'm assuming with her background, she used the radio to get to the Nepalese community, which is what I think we need to look at, ways like that to get information and support out to other members in the ethnic community.
Okay. Thank you, Deepak. Sarah, would you like to comment on this question at all? in terms of access to services and generally?
Yeah, I mean, I think Deepak's covered a lot of it, to be honest. I mean, I think it's exactly what he was saying, that, you know, at the beginning we didn't really know what we were dealing with. But now that I think there's a much different focus this time around, that we're keen to keep, I mean, I don't work within the acute setting, I'm more within public health, but, you know, there's a keen to keep, you know, services ongoing, particularly within sort of trust, and being aware that, and I know we're happy, very eager for everybody to realise that, you know, the NHS is still functioning and still going, and if people do need to see a doctor or do need to have that medical care, then that is still going, because we don't want people to be sitting on symptoms other than COVID at home and not happy to, you know, get that care when they need it.
Thank you. Our next question, because I'm mindful of the time, is for Julie. The question is in twofold. The preamble is, Julie, there is, how is this affecting babies born just before and during the pandemic? And will ongoing isolation with no family or peer support in the first few months of life have any long-term effect on babies?
Wow, thanks for the question. I can only speak for on the side of what it would do, I suppose, to the brain. So obviously now we're going to have lots of studies coming out looking at these effects. I mean, I know in my department we had to switch and amend some of the studies going on to actually include the COVID side of things, because obviously what we're looking at is the effect of the virus, but it's also effect in relation to the question with isolation, in terms of it could be adding stress to the woman. So I'm going to talk about the pregnancy quite a lot, because it starts there really, but postnatally, the fact that women might have been under increased stress because we do need support. Let's remember that women who are giving birth, they have no partners. When they're giving birth, they come home, they don't have the father there either to help. But it would have then been the fact they wouldn't have extended family. In many families, they'll have somebody coming in and looking after the child, or maybe you know, caring for the home or cooking or something, you know, allowing parents to kind of either bond or simply just sleep and rest. Women who are not able to rest and have other duties in the households, again, like I mentioned, women would have been giving birth, might have a very strange birth experience during the first lockdown when there were many restrictions. So no partners, or very limited, you know, access for the partner to be there. The birth experience, some women have talked about their birth experience, you know, having been stolen by the pandemic. It was their first birth, so to give birth the first time around, this huge change in their life, and they had expectation, and for women, expectation not met kind of comes with kind of a disappointment. That's really difficult to deal with for many women. Then they come home. So again, the amazing role of health visitors to kind of be the first line there. But that when I'm thinking about, on the effect of the child, it would be indirectly through the capacity of the mother to deal with the new stress and the strangeness of the situation. But yes, when we say it takes a village, you know, to raise a child, it's so important. People don't realize that. And like myself, I had no family around when I gave birth to my children in this country, but I had access to social support, to be able to go to the moms and babies groups. It was essential for me to go and speak to other moms, to meet with them, see the other kids, having maybe a hot drink while it's still hot, because the kids are just lying on their backs there. And really, it's so important. And I will take that from the side of the mental health. But surely, I mentioned some of the issues with the medical side of things. If they were not able to get face-to-face contact, and some things might have been missed, you know, it includes safeguarding really, you know, in those times. But things have improved. I think people have really communicated really well the change that had to be done in case of the second lockdown. So we're hoping that there'll be much less effect in this lockdown. And I mentioned in my response that if you can have women interacting with other adults and their children not counting in the tally, this will have huge impact. I mean, it's hard in best of days to have a newborn and deal with a newborn. What if you had a newborn, 2 toddlers around, somebody to homeschool, or 2 to homeschool at the same time, a father, you know, who has to work, who's a key worker? I mean, you just can't imagine the situation in the home. It's so hard. It's really hard. I had 3 children. My eldest was 3.5. I still have the support system around me. It was really hard mentally. And the isolation, nobody tells you about isolation in the best of times. So yeah, that's my answer. Look after these women, please, you know.
And I think I would like to, there's been a rejoinder question to this one, which is that since so many of the family support services were closed, how have young children been supported without the valuable venues? And I'd like to ask Miss April to answer, please, or to start the ball rolling. And I'll come to you, Sarah, afterwards.
Thank you. So just to say really that during this second phase of the lockdown, that support groups are still available for parents with young children. So I was just thinking about that. If people aren't aware that those services are still available, those support groups, that's certainly something in public health that we could think about, doing some communications around that to make people aware that those support groups are available this time. Because listening to Julie's story, it just really does make you realise how important it is that parents and their children don't become isolated. So I think that's really important for us to hear that from public health, if people aren't necessarily aware of that. And so we can definitely do some communications around that to make sure that people know where that support is available and those groups can continue.
Sarah, would you like to add anything to that?
Yeah, I mean, I just wanted to add, and I think one of the messages in the chat was saying about how were families supported during the earlier times, and I mean, I know it's obviously not as good as what it would be like pre-COVID, but there has been a lot of support for families of young children in terms of like the health visiting service has still been running. It has had to move, virtually, so it's been more kind of telephone calls or potentially Zoom chats, but there have been some positives around that, in that they have potentially been able to reach more families in different ways because of not having the sort of travel and things. The family hub, although its doors were physically closed for a long time, they did move a lot of stuff again online. I mean, I'm conscious that never reaches everybody and not everybody can get online, but there were services available to families. They ran some of their groups online. The library service has done a regular storytelling as well to kind of try and capture and speak to young children and kind of provide that sort of support. I mean, I completely agree with a lot of what Julie's saying around social isolation for families of young children. I've got young children myself, and I can only imagine what it must have been like for people giving birth during this time, just incredibly lonely time. And I think, but I mean, we have seen a couple of things. There have been some positives. I think quite early on it was felt that there was possibly going to be a positive impact on breastfeeding, because families, mothers were able to be at home and completely concentrating on, their newborn and giving them that sort of undivided attention rather than possibly being pulled in lots of different directions by having loads of visitors. So there was some sort of thoughts that there might be a positive impact on breastfeeding initially on. And then we also know that, like now, I think it's, really, really positive that we have that parents, that smaller children are not counted within the numbers, so that, parents with very small children can then go and have that, contact with other people. I think that's just so important to acknowledge that. And as April just said, we know that the, support groups, particularly around like postnatal depression and breastfeeding support, are ongoing now, and they are exempt from the government restrictions. But I suppose another point is just that we know that the most important thing around sort of children's development long term is about the parents' attachment to them and how the parents' well-being is. And so I think anything that we can do to support families and parents of young children is just so important, long term. And I think we recognise that in public health. And and the sort of wider council support. And I think we're really, you know, working really hard to try and keep those support services available for families.
Right. Thank you. We've almost run out of time, but I think this is an important question that we should answer, we should discuss. And it's going to Shishigari. Somebody asked the question, well, what should you do if you don't have a confiding relationship?
Yes, good question. So we got the helplines, we got the national helplines, and there are support groups or support helplines for a variety of things. If you search, I mean, like Samaritans is one example, but there are a lot of other helplines, and also 111. They can kind of direct you towards the right help. And if it is reaching a threshold, you need to go and see the GP, and they can see what is locally available.
But we've just seen from the poll, the last poll, that not many people access helplines, at least not in this group.
Yes.
So I think a lot more work needs to be done, doesn't it?
I'll tell you one thing. See here, if somebody is not having that kind of relationships and not in a position to access the helplines, we need to think he is a needy person. He has, he has some needs which are not able to be fulfilled. So as a community, the people who are around him, he will have a family, he will have friends. They need to, pull him in the sense that they need to point him, they need to support him.
Okay. Right, thank you.
Sure.
Well, we've run out of time, unfortunately, for this segment. But if you still have questions, please do pop them, and you should be able, Alice, you should be able to download the chat into a file format and send answers out when you get them.
I know we will do that, and as we go along, kind of thing. Whatever questions we have not responded, we will try and get an answer.
Okay.
And huge thank you to everybody who's asked questions, taken part. We'll try and capture all of them. And I think in terms of Dr. Rao's answer, and I think we have, Victor, I think you picked this up brilliantly, that isn't it interesting that there seems to be an approach that there's a helpline for everybody, but we seem to have this reticence to necessarily use them. And I think we need to look more into what's the bridge, because maybe there's if it is people's friends or their colleagues or their work groups, but often we live in a country where people kind of are told to sort of, get on with what you get on with and not involved. Maybe this cohesion we've seen with the communities helping each other out possibly needs to extend into how are you doing? Are you okay? Questions we might not normally ask, and I think Dr. Rao, you might be better to quickly answer that, to see, because we're in a situation we've never been in, do we do things we wouldn't necessarily normally do?
I think so. We need to check out whether, everybody is affected to a variable degree, some people more than others. And within our contacts or within our social groups, we know the people who are not help seekers. They don't seek help. And we need to be aware of that and go that extra mile to see, is he in trouble, but he's not able to seek help. And then we need to act on his behalf. What should be done? See, once we can put that protective umbrella on his head, I think that will come in. Now, this is the time where the community need to step in, need to go that extra mile.
Thank you for that, and apologies to everybody, because I'm the one who's delaying everything. We were bang on time, Victor, so thank you very much for that. So the last thing I just briefly wanted to cover off, and this is really, really important, is if anybody in the forum thinks we haven't covered something off or you haven't put it in the chat, either please now do put it in the chat, or contact any of our speakers or Communities United or Healthwatch West Berkshire. Drop us an email. We're easy to find on the web. Give us a call. and we'll pick up if there's something we just didn't have time to do because we've covered so much. And, you know, I really, really, really want to thank our amazing speakers. I've genuinely been just sat there with my mouth open, listening to both the stories, the testimony, the wisdom. There's some really good stuff to take away, and also some really shocking things in terms of how this pandemic has affected people. It's really real, you know. So when you hear people talking about, well, it's not, you know, it's the same as flu, you know, you talk to some of the people in the room, it really, really isn't. And people need to take care. You know, although we've had some good news on the vaccine, it's months away for most. So, you know, the virus is still as dangerous today as it was back in February. Fortunately, we know a little bit more, and I think services have maybe reorganized themselves slightly better. So do get in touch with us if we haven't covered anything. Feedback is essential. We can take this back to our colleagues in the clinical commissioning groups, in adult social care, in public health. And, you know, thanks to all the guys from public health for turning out tonight. You know, okay. Brilliant for you to give up your time as well. And also what we've got to discuss is what's next for the West Berkshire Diversity Forum. We have shown there is an interest. We have shown there's a feeling that things need to get better, that things need to change. So I just want to thank all our speakers, all the organisers, Communities United, Public Health, for giving up their time. We've got one more poll we'd like you to
Andrew,
to fill in. Alice, yeah, fine.
And also for Dynamics as well, Rob,
yeah,
for helping
Rob,
us. Yes.
Thank you so much. You always get forgotten. You're the guy that makes sure everything happens.
Honestly, just don't want to say thank you so much, everyone, and you know, enabling us to have this event, because I don't think, you know, we've heard as much as we could. I mean, because we are told that the ethnic community is the seldom heard. We've heard you all today, and yeah, thank you. I hope you all have enjoyed the forum, and the feedback's been amazing. But we would like to send out a survey soon to see what your feelings are about certain things that we would like to find out from the community. Sarah, do you have anything to say?
No, just I suppose just saying thank you for having me, and thank you for this. I think it's been really great and really informative, and to the speakers as well. I think it's been really useful insight, so thank you.
Julie, you've got anything to say?
What do we want to say? Do we say thank you to everyone?
Thank you.
And I thank them for the patience.
Yeah, yes.
It's been a long night. I bribed them with some biryani I made.
Oh, okay.
Thank you. I'm so glad we met today. I really, I'm really glad. Thank you. Thank you.
Dr. Rao?
Yeah, very well organized, very, you know, very professional, very nice. Well done.
Thank you. Julian, final say.
Final say from me. Oh.
Yeah. You've been quiet.
Well, thank you. I mean, without wishing to bore everybody rigid, it's been a really fascinating, enjoyable, at times moving, at times entertaining, a really good hour and a half of time spent. And I hope everybody who has said in the survey just now that they thought it was worthwhile genuinely feels that. I certainly do. There's been some really fascinating personal experiences shared, which I think help to make things much clearer. And I think we've all learned, you know, even those of us who are medical professionals, and let me hastily add, I do not include myself in that category, will have learned, I'm sure, from the experiences shared by others. So thank you everybody for coming. And I was going to say, by the way, somebody just touched on the possibility of dealing with people who are perhaps technologically challenged, if that's a diplomatic way of expressing the point around people who may not feel comfortable using Zoom. You don't have to use Zoom to join in. You can simply use a standard telephone. It means you won't have a video, but you'll be able to at least listen in and possibly take part if you want to, simply by dialing the telephone number and then typing in a few numbers. So that's something perhaps worth sharing with people who, you know, genuinely do feel a bit nervous about the technology that we're all using today, that they can actually use the standard technology that they've got in there on their hall table or in their living room or whatever, and just pick up the telephone and join in that way. So I think it's perhaps worth conveying that to people as well.
Thank you.
So worth bearing in mind.
Julian, can we have last say from Deepak? Deepak has come back.
That would be if
No,
Deepak
not last say. I think the last say would still be for Julian. I'm sorry, I could hear all the audio, but Zoom stopped zooming. It got frozen. So I could hear the audio, but I just couldn't contribute anything at all. And it keeps saying load disk space. So thank you so much for having me. And thank you to Andrew, Alice, and all members in Community United for doing such a wonderfully organized event with such a good turnout. So I hope I have been of some use, and please don't hesitate to get in touch with me for anything around pain management within the community, of any awareness related to pain management or COVID that the community could benefit from.
Thank you, Deepak. You may be absolutely certain that we will be in contact with you again. That your contribution was very valuable, as indeed was all of our speakers. It's been really a very good evening. So with that, I think probably it's a good opportunity to bring it to an end. If you do have any last minute points to put into the chat, please do, and we'll make sure everybody does get answers to that. If you want to provide more feedback, there are email addresses on the screen at the moment, both for Community United and for Healthwatch West Berkshire, and telephone numbers. So do please feel free to use those. Get in touch with us and give us your opinion, your views, your thoughts. If you need any help, if there's any problems or queries that you know we can help by directing you to people who can provide support, that's what we're here to do. So please do take full advantage of that. You can also find more information on the Healthwatch West Berkshire website and also on the Community United website if you missed that flash of information that appeared before your very eyes just then. So thank you all very much again. Thanks especially to Alice and Andrew from Healthwatch, who are the prime organisers behind this event. I wish you all a very good night. Thank you very much indeed.